Hello, everyone. Welcome to the Global Metabolic Health Conference organized by D-Life. I'm your host, Priyanka Mathanelia, a PhD, and I also practice as a nutrition and lifestyle coach. I'm associated with D-Life, which was founded by Mr. Anup Singh. Today, D-Life is one of the largest and fastest growing community of low-carb nutrition coaches with expertise in reversing metabolic health diseases. I would also like to thank Mr. Shashikant Iyengar for being my mentor and guiding me through my low-carb journey and my approach as a nutrition consultant. Today, I have a very, very special guest with me, Dr. Mrudul Kumbhojkar. Dr. Mrudul is a licensed medical doctor. However, she branched out into low-carb nutrition coaching to help patients reverse metabolic diseases. She arrived at this decision after her personal journey of reversing her PCOS through low-carb diet. As a young doctor, she faced many challenges and hurdles to overcome family and social pressures to switch from traditional medical practice to being a nutrition consultant. From what I have learned about Dr. Mrudul in the past few days, I really admire her courage for leaving the safety and comforts of a traditional doctor practice and embark on an unconventional path of as a metabolic health coach. I'm really delighted to talk to her and excited that today she will share her personal journey and stories of success with her patients. Hello, Dr. Mrudul. Welcome to the session.
Yes, hello, Priyanka. Thank you for this kind introduction. I'm so excited to talk with you and share my journey here. First of all, I thank D-Life for giving me this opportunity to speak in this mega conference, and it feels great to share my journey.
Okay, I will just share the screen for the just one. I'm not able to share the PPT.
You can open the PPT first, and then you can simply click on a share screen. The access has been given.
Acha, because it kept saying it's denied.
Yeah, access has been there. It's already there.
Okay. Let's see. No. Grant. 1 minute, sorry.
Any issue, ma'am?
Let's see. I think just a moment. Can you see my screen now?
No, ma'am. You have opened it in your laptop, but you have to you need to come on the Zoom platform and just click on the share screen.
Yeah.
Yeah.
Can you see
now it is there. It's perfect.
Yeah.
Now you can just do the slides mode, ma'am.
Yes. Sorry. Thank you.
Perfect.
Yeah.
Thank you, ma'am.
Thank you. Okay, so Dr. Mrudul, I'm really curious to know, how did you get started on this journey of low-carb nutrition consulting?
Yes. So I took admission to MBBS in 2013, and it was the exciting pages of my life, a dream come true moment. I was following the footprints of my mother and was very excited to do my favorite graduation. So it started in 2013. The journey was, of course, a roller coaster ride. I was enjoying it, but until in my final year, I realized that I have gained a lot of weight and I was diagnosed with PCOS. So I had gained almost 15 kgs, and
Wow.
that was the point where my excitement of availing this noble graduation degree of MBBS suddenly came to a halt, as by knowing this diagnosis. I would like to add that it was PCOS. It's a condition called as polycystic ovarian syndrome, and it has a triad of symptom like obesity, then excessive hair growth, and irregular menses. So I was facing this. There were irregular menses, and this got me into the dual stress because it was my final year of MBBS, and this unwelcomed disease.
Right.
So yeah.
Yeah, it must have been very, very difficult to manage this being a medical student, the pressures of, studying medicine
Yes,
and
absolutely.
living in hostel, right?
Right. I was
Away from families. So, yeah. So how did you then manage to complete your degree?
So in that final year of time, I diagnosed it. Then me and my mother, she is a pediatrician. We both went to endocrinologist, and finally, all with all the medications, lab investigations, I started doing the remedy. And the priority was, of course, completing MBBS. So I kept aside PCOS for some time, and I cleared my MBBS in 2008.
Right. Wow, that's really, really commendable.
Yeah.
Congratulations. Yeah. Unlike, despite the pressures, because I know PCOS can be very, very debilitating, especially as a young woman, the kind of lethargy, the fatigue that you experience. And despite that, and not getting good food in the hostel, waking up late nights, it could be very, very challenging.
Yes,
So,
yes,
yeah.
it was. So now, as my exams were over, now the time has came that I need to reverse PCOS. So I started doing gym, and I hired a personal trainer also. Also, I met a dietitian and followed her nutritional plan. So this led me to a weight loss of 15 kgs, and I also reversed the hormones also. So that time I was into the remission phase, but I was doing everything in the holidays, which we get after the exam and before starting
Okay.
of the internship. And now,
Right.
finally, I
Mhm.
went back to college. My internship started, and that was the challenge began from there because my food pattern got changed, and again in just 2 to 3 weeks I gained up again 4 kgs.
Oh
So
my God.
yeah, because I was in the home and I was eating homemade food, so even gym was there and everything was there, but my nutrition, my homemade food was there. So weight loss करना easy हुआ. But जैसे internship चालू हुआ, the change was that food got changed. I was eating canteen food, and mess food was there. So I gained
Right.
4 kgs, and that alarmed me. And I got curious that if you want, nutrition or food plays an important role.
Right. So I think that's a very good lesson for a lot of young people who think, canteen food is okay because it's like, Indian food, it's probably not processed. They think that way, but it's not true, right? It does affect our health. Even if you are younger and you have good metabolism, etc., it can affect your health. And despite gymming, because a lot of people think when they gym, they can eat whatever they want, right? But that is not true, right? Gym has nothing to do with your weight loss as such, right? As you discovered, I'm sure you will talk a lot about it. Yeah. So what happened, like once you realized that nutrition is the main cause of your, disease coming back again and the weight coming back again, what did you do next?
So when I realized this, I started doing some research, and research was on YouTube. I started seeing some videos, and then I came across Dr. Rohini Patil. She's an MBBS doctor, so I related her with myself a lot, and she was doing nutrition practice. So I saw her videos, and I made some minor changes. Like for example, she also used to tell me that to eat. She used to tell in her videos to eat eggs. So I started making these changes. Ki canteen mein jaake I used to eat eggs. Then the intake of tea was more because I was doing internship and late night shifts and all this stuff. The intake of tea was more, so I cut down consumption of tea, and I made these
Right.
changes, and I saw differences that there was inch loss. So this gave me the curiosity
Wow.
that I want to learn nutrition and science. So that was my
Okay.
start.
Wow. So you were quite like, you actually, I think what fascinates me is that you did not find the answer in the traditional medical education that you got. You actually had to go and do your research online to learn about nutrition and how to manage your weight. I think that's another big lesson for a lot of young people today, that, one has to manage weight, one has to go to right sources where you can get nutrition education.
True. Yes.
Okay, so what did you learn, about, how did you learn about low carb nutrition then?
So I talked with my parents regarding this, and then after all the research, my mother and me were searching for the authentic course because she wanted me to pursue a post graduation into nutrition, as after seeing my interest. So I got took admission to masters in public health nutrition. That was my post graduation after MBBS. That was the first,
Okay.
and it was basically designed for doctors to treat malnourished children in the community. So I used to go
Right.
into the field work. We used to design the midday meal programs, the nutrition program for the kids. So that was the structure of my post graduation. But later,
Okay.
as I wanted to do, my interest was into the obesity or diabetes, which is the leading problem right now. So I started doing my research, and then I came across K11 nutrition program, and that was rather first my step into the world of fatty protein, and I came to know about low carb over there. So
Right.
there I learned about endurance nutrition, athlete nutrition. But again, being a doctor, I wanted to treat my patients metabolic disorders on nutrition and lifestyle, as how I had done on myself. So still I was my research was still going on, and then finally I came across D Life.
Okay. So in D Life, what did you learn?
Yeah,
How did that change your perspective about nutrition per se, right? Yeah.
yes, because in D Life it was a thorough thorough nutrition science, and it was basically from the like starting from the human evolution till all the recent advances and new remedies were there, everything based on the nutrition, like what is insulin resistant, what is the root cause, how to treat the root cause first. So ये सब D life में मेरा clear हुआ, and I found out that now I'm confident enough to treat my patients.
Okay, so that must have been quite a revelation, that, so what did your parents think about this whole, change in plan? Because you had this dream of becoming a doctor, and suddenly you are changing courses, and your mother is a doctor too, and traditional doctor. So how did she react to this, whole business of doing nutrition courses, 2, 3 nutrition courses? How did she react to it?
Yes, there were conflicts, there were arguments. Like it was whole 6 months. Like I'm telling them my side, and they were even telling me to at least give the entrance exam of MD. But I even denied that. But then after seeing the change in me, my reversal of my health, everything, my mom saw the passion towards this subject, and she helped me then. And she was with me in this whole journey.
And what about, low carb nutrition was actually very appealing to you? Like, what were the things that you were actually attracted by? Like, so you went through this whole medical education, you learned about various diseases to treat with pills, right? But in this, they are telling you to treat diseases with nutrition. So how did you, what really surprised you about it?
Main thing which I experienced is when I started doing low carb, that it kept me a long period. I had the satiation. Okay, so I don't used to feel hunger. जो पहले regime में मुझे every 2 hours 3 hours I used to feel hungry. So that I saw because I used to eat in a calorie deficit manner. After this low carb, I came to know the importance of dietary fats, and then eating nutrient dense food, and how it kept you full for long, and this reduced my cravings, my every kind of hunger pangs. So yes, that was the difference I found out by taking knowledge of low carb.
Okay. So when you say fats, right, dietary fats, and most of us, I know young people especially, they don't like fats at all, right? I'm sure you have friends, and if you're taking fats, so what kind of fats you took, and what was the reaction of your friends or your parents, when you're eating so much fat?
The reaction was, of course, they were surprised to see that I'm eating gallops of ghee and cooking into butter. But then I just they were surprised initially, but then later, after seeing my results, seeing myself, seeing my health, my mother also accepted this. And yes, there is a scientific way behind it. They understand, and then they are in my journey. They are happy to see me working in this field.
Okay. And what about your friends, the doctor friends? Because, obviously you branched out,
Yeah.
but they were still practicing. So how was their reaction? Were they, accepting of the fact that you are doing something different? How did they react to it? Did anyone try to adopt your this thing, or they were like very, no, this is not good?
Yeah, there were mixed of the emotions, that some were like, what are you doing this? Um, we don't know the scope of the job, everything like that. But then also there were some friends who were like, okay, you have interest into this and you can. Or my parents were with me, and that's all sufficient in changing the path.
Okay, so I guess family support is a
Family
very,
support is,
very,
yeah,
very, very important factor, especially being in India, because our family, if they stand by us, then change can happen.
yes.
Okay, so how did you start as a nutrition coach? Because till now you were doing your graduations and studies, and what was the first step you took?
Yes, so along with my masters and all the course which I was pursuing, side by side, I was doing awareness on low carb, because I found out that the public is not much aware about low carbs. So my
Right,
weapons were social media. So I started
nice.
creating awareness on Twitter, Instagram, and then eventually the social media awareness started creating buzz. And then yes, I
Okay.
was started getting clients through it.
Okay, so when you went on social media, what were the reaction of people who started following you or looking at your tweets? Were there a lot of questions about this new approach that you were talking about? What kind of questions would you get?
Yes, I have faced a lot of trolling for this, because you are telling something which is very unconventional according to the mainstreams. So eating fats, then fear of proteins is there in much in people. So I used to try my best by sharing the scientific reports, by sharing our D-Life podcast. So I was doing my minor contributions, but I had decided that I have to make this change, jitna as much as possible for me.
Right, right, right. So you stuck to your own, and I think being a part of D Life community also probably helped you
Yeah,
in
yes, this helped me
your
a lot.
social media mission, because there's quite a budding community of nutrition experts on Twitter and Instagram these days,
Yes,
and especially D Life members. So
true.
yeah, I think that is quite good. So let's talk about, I believe you were also invited then by the mainstream media to talk about it. How was that experience?
Yes, so this low-carb buzz on the social media, by seeing the mainstreams, they approached me. The first podcast was of Bol Bhidu. It is a Marathi podcast, and later I was also invited in Pune University for a radio talk show. And
Mhm.
now, recently, I shot for a podcast on Sakar. So Sakar is a very leading
Right.
newspaper of Maharashtra. So these were the
So
changes.
as a young doctor, it must make you feel very, very, how do you feel that, you are presenting this very, very new knowledge to the world, which is also very contradictory to the medical practice. So how does it make you feel, and how do your friends now react that now you are being invited by mainstream media to talk about it?
Yes, I just feel that yes, my decision was right. Even now, my parents are also proud of me, and
Nice.
yeah, मतलब जो भी decision लिया, I was
Uh-huh.
not, I didn't thought of any of this will happen in future. But मुझे ये करना था, इतना ही target था, and I did this and it's going just well. So I'm feeling good about this.
Nice to know. So you also started your clinic.
Yes. So as the awareness on social media and I was getting patients, so I even got some of the patient told that they want to meet me in person. So I gave a thought that I need to set up my own clinic. So I was doing job. So along with my job of medical officer, I set up my clinic in Kolhapur.
Okay, along with being a medical officer, right?
Yes.
Okay. So as a medical officer, what was your experience as a medical officer? Could you just talk a little bit about it, especially after getting this nutrition knowledge? What were your observations there and how did you feel about it?
So medical officer is basically work based on MBBS and my post graduation, which was public health nutrition. So we used to set up the conduct various programs, the vaccination program, nutrition program, then all the abhiyan which is designed by the government. So we used to we run into the community. So that is the main job of a medical officer. And with that, I also had the part of NCD, that is of course our non-communicable disease. So that is diabetes, everything. So yes, in even the community में भी बहुत वैसे लोग who are facing a lot of obesity है, then PCOS है, then there is diabetes. So there are a lot more of those people also जो कोई भी junk नहीं खा रहा है. They are, like we say that BPL people, below poverty line, but still they have all of these metabolic syndromes. So but as such, I was not able to do the nutrition practice over there. But मैं थोड़ा just suggestions and just थोड़ा दे रही थी कि what you have to stop, what you have to start. Okay, small changes, what you have to make to stop the rice, to switch from chapati to bhakri, that is jawar. So small changes they used to make. And yes, that is a scenario. Even in community, there are a lot more of metabolic disease.
Right.
Yeah.
So that basically, made you think that, there is a lot of need for actually metabolic health reversal rather than just, so
yes,
you,
not talking.
so what are these pictures? Could you tell us about
these are
pictures?
some of the glimpses of my inauguration ceremony of my clinic. She is Dr. Geeta Pillai. She was the president of Medical Association of Kolhapur. And in this picture, my family, we are all sitting into my consulting room. So
okay,
yeah.
So basically, through your mother, by convincing your mother, you also convinced other senior doctors in your community, in your town, that this is something to be, something to be practiced. And it seems like they are quite supportive of you.
They all loved my decision, and they all supported me. Yes.
Okay. So now could you talk about, a little bit about the personal challenges? Of course, your family has became supportive about low carb, but I believe you did face some challenges. So could you talk about the challenges that you faced on a low carb journey?
Yes, as I was doing well in my job and even my clinic, so I felt that let's get settled into the personal life also. So lately I got married in this year. I met this guy on matrimonial site only, but it was not directly through parents. So I met him and I wanted to tell him my food pattern because he belonged from a vegetarian family.
Oh, okay.
Yes.
That
so
must
I found
have been
that it's very important to tell him. I told him everything and he was very supportive. He just told that we can do on eggs and paneer. Just it was not allowed to cook meat in home. And realizing that the guy is supportive, I went ahead.
Okay, so I guess this nutrition is now also impacting marital decisions for young people. But these are important decisions, right? Because
Right.
it impacts your whole life and, peace in the family. So how did you overcome these challenges?
Yeah, when I discussed with him, he gave me all the support. And if you want to eat non-veg, we can go outside and we can eat. And the question of low carb, you can do it on vegetarian also or over vegetarian. So I was eating eggs and paneer
Okay.
and veggies. So my concern was to do low carb. So wo ho gaya, vegetarian mein bhi ho gaya.
Okay.
And see, you can do it
Uh,
when you leave the grains or
Okay,
carbohydrates.
so it doesn't matter your culture, etc. If you want to do, because in India, as we've been discussing throughout this conference, there are a lot of people who are just vegetarians, and then they feel that, okay, how can we do low carb? So basically, you've experienced both sides, right?
Yes.
And you think that it can be done. It does not have to be very restrictive to just meat or
Non-veg.
eggs. It can be done by vegetarian people as well.
Yeah.
Very good. Nice. So now could you just tell us a little bit about your nutrition consulting process? How do you go about, consulting?
Yeah, so I'll tell it. It's a three-step approach. So understanding the patient is the first, that I take the thorough history, then transitioning to low carb, and then the last is measuring the outcomes. Into three consultings, it happens. Yeah.
Okay.
Then the first consultation where I take all the detailed history, all the medical issues or the symptoms the patient is going through. Then I give him the detailed list of all the blood work which I need that should be done. Then that is the first basic consultation. Then next, after the reports, I share the analysis of blood report and then discuss what will the program will be about. And I ask them if they want to enroll into it. And then third, last is I share, they get ready for enrollment and then I share the customized plan. And then the coaching begins to explain them what is low carb, what is high fat, everything so it's a coaching. Whole 3 months is the coaching.
Okay. So when you do, when you start explaining the importance of low carb and high fat, what kind of questions or surprises, or resistance you get from your patients who come to you?
The major which they get the fear is fear of fats and restricting carbohydrate, fear of fat because it will rise cholesterol and फिर वो heart attack आएगा, and then these kind of fear they have. Then next is restricting carbohydrate. If we restrict lot of carbohydrate, then we will be on low on immunity or will feel giddy, or skipping breakfast. अगर breakfast नहीं किया तो कुछ मतलब चक्कर आएगा. These kind of fear they had. And the major fear is fear of proteins. High protein.
Okay.
जब भी मैं बोलती थी तो they used to have a lot of fear that it will damage kidney and these kind of stuff they had. But in this coaching, I used to do their counseling. Counseling helped a lot. I shared them all the scientific evidence, then videos, podcast, and whatever query they had, I used to explain them in their simplifying in their language, in the complete layman language, and they were agreeing to it. Moreover, the social media awareness had created a trust, and so they were knowing ki kya rahega plan, and still they were enrolling into the program.
So I guess social media is also a very, very important aspect of, this. Okay. So in the second step, you say like you just implement. So what are the challenges, or how's that journey, progresses?
So after doing this all counselings and explaining them, they enroll into the coaching, and then it is a 3 months or 6 month journey, whatever they opt for according to their metabolic health issues. And daily update on WhatsApp of what they eat, daily food updates. I take it on WhatsApp. Also, there is weekly call from me. And any query if they're having, it is cleared as soon as possible on WhatsApp. If it's like a lot more than that, then I get on a Zoom call and I discuss with them everything. So everything is I do clear at that time itself.
And what about recipes, because I believe when people are doing low carb, it can get very monotonous also sometimes, and, challenging to eat the same food. So do you get such questions as well?
Yes, I have I give them my if the person is non-vegetarian, then non-vegetarian recipes which I have experimented, so I give them that list. Also, if the person is vegetarian, then Sindhu ma'am's book I recommend to all of my,
Right.
mostly I have recommended to all of my vegetarian clients, and they're happy with that kind of all the recipes. So whenever there is monotonous, I give them the YouTube videos also to try new recipes. So it works.
Nice. So Sindhu, I will just, for the benefit of our audience, I'll say Sindhu Vijay is a very, very, stalwart member of our D-Life community. And she's written a book of vegetarian recipe book for low carb, low carbers, people who follow low carb diet. Yeah. Okay, so measuring the outcomes, I think this is probably the most exciting phase of this low carb journey, because people see real results. So let's talk about that. What do you could you, if you could share a case study to explain the outcomes, it would be nice. Yeah.
Yes, so I'll tell about this patient. So he was a 30-year male, 185 centimeter heights, and he was very obese of 110 kgs. Like if
Wow.
we see according to the height, his weight should be 85 kgs, but then he was 30 kgs obese, and he came to me with the symptoms of acidity, indigestion, bloating, irregular bowel movements. There was disturbed sleep. He was facing lethargy, then drowsiness, tiredness. He used to get a lot of hunger pangs, cravings for sugary food. So mainly he was an IT engineer, and
Okay.
yeah. So that
So
was
yeah,
his.
if you could tell us, like, what all kind of information did you take from him at the initial phase?
Yeah. So I got to know all his dietary habits. So he told me that I eat lot of fast food because he stays in the, like, he lives bachelorette life. So ordering food from Zomato, then Swiggy. So I eat lot of fast food. I have lots of sweet cravings. I get hunger pangs. So that was his habits. Also, lifestyle, he was having sedentary lifestyle. It was his work from home, so he used to sit and do the work. Then disturbed sleep, and that was his overall lifestyle. And so I gave him the blood work to do. That was fasting sugar, then fasting insulin, then lipid, and the KFT, kidney function
Yeah.
test. Yeah.
Okay. So could you explain why you wanted these tests to be done? Because it's not like he came for diabetes or anything. What is the significance of these tests? Yes.
When I came to know about his symptoms, I related it with that his weight also. So I need to know the root cause, as I know that the root cause will be obviously insulin resistance, because of these kind of lethargy, then drowsiness, tiredness, fatigue. I came to know that I need to work on the root cause. So my pattern of the consulting is I tell them to do this kind of blood test, and after that blood work report, everything has been, the picture gets clear more.
So could you explain a little bit about insulin resistance? Because I think most people are not, because fasting blood sugar, of course, a lot of people are aware because it is directly seen as a symptom of diabetes. But fasting insulin, why is that important? And if you could explain the concept of insulin resistance, because a lot of people don't know about it.
Yes, it's the most ignored test, fasting insulin. Basically, insulin get resistant because it can't take up, the body cells can't take up more of your glucose. That condition is basically insulin resistance. And when that is the underlying cause, the many of the metabolic disorders, like increase in visceral obesity, visceral fat, okay, so all the metabolic, like PCOS,
So
diabetes.
visceral fat, you mean like the central obesity, the
Central obesity.
fact that people put weight on their waist and the hips, that is probably is so a lot of people can be tofu, like thin outside and fat inside, is what you're saying.
So
Okay, so
even though you, by physiologically, if you look at the person by the appearance, he will be like lean also. But if we check his blood reports, and if we check the fasting insulin, then he can be insulin resistant.
Okay.
Yeah.
Okay.
So that test is very important.
Yeah. So do patients, ask you, why are you asking for these tests? Or they resistant to do these tests, or they agree to do these tests easily?
Yeah. Patients agree just to do every test which I tell them, because before that I explain them the
Okay.
plan. Yeah. So they
Right.
get ready to do the test.
Okay. So there is no problem with that. Yeah.
Yeah.
Okay. So what is the plan? What was his plan, if you can
Yeah.
tell us?
So I kept him on ketogenic dietary regime because of the lifestyle he was following, that is ordering the food from outside. So I told him that you have to go off grains, you have to go off sugar, seed oils, and all the junk. And he has to increase the animal based proteins like fish, chicken, mutton, eggs, and combine with all the veggies. So he used to bring the tiffin, but then later he's मतलब एक cook लगाई उसने, and then now he's cooking in his home. So this
Okay.
was the food, that is mutton and bone broth. So also I told him to do intermittent fasting. Once a week he used to do water fast, that is only to be on water, like water in
Okay.
liquids, black
Mhm.
coffee or green tea, like that.
Okay. So could you explain why ketogenic dietary regime was important for him? Like, why did you recommend ketogenic diet to him?
Because like after when his I got his reports, he was severely insulin resistant. Also,
Okay.
his lipid profile was deranged completely. And it sure short, I was knowing what is the cause, that all what he was eating, the junk and whatever the abuse he has done to his body by consuming all the carbohydrate. So first and foremost, I told him that you have to cut off every, means junk to cut
Right.
off here, but with that also you have to cut off grains and sugar.
Right,
So
right, right.
he got agreed on this.
Okay, that's very surprising that, a bachelor hired a cook and everything. So you must be very convincing to him.
Yes.
Uh, okay. And what about fats? Was he resistant about fats at all, or okay with that change? Because
Yeah.
that can be because a lot of young people like, oily or chips, etc. So how did you convince him to use healthy fats?
Yeah. Basically, जैसे I told previously that every client was from Twitter. The source was Twitter.
Okay.
So they used to read my tweets and they were knowing already that कि क्या
Okay.
खाना रहेगा. So वो एक उसका
Acha.
mindset was ready, and he got agree immediately, and he just knowing, was knowing what is ketogenic and what I want to do, but he wanted the coaching, wanted
Okay.
someone to monitor daily, and
Okay.
so he approached. Yeah.
Okay. And intermittent fasting, can you explain like what is the significance of intermittent fasting in his diet plan?
So fasting is basically, I believed, it's for autophagy mode. So you put your body on the autophagy, and that is what I explained to him, that the stage where your body cells start to phagy, like to eat your
Ah,
fat cells. So that was my intention of intermittent fasting, and it works because you don't get that insulin spikes every
right.
2-3 hours. So
So
yes,
basically it works at a cellular level, you're saying.
right.
Okay, nice. And he started on also on exercise, strength training. So
Yeah,
how does that help in diet plan?
he was doing exercise, but he used to like 2 to 3 hours. He used to do the gym. So I told
Okay.
him that just do 1 hour strength training, and that is also for 4 days is enough. Don't give much importance to the exercise, because I believe in the ratio of 80 to 20. So
Okay.
80% is the food and 20% is just exercise. So do that like that. So that was like, he was like agree to it, and now he's doing only 4 days, 1 hour exercise. That's it.
So actually correcting your food and nutrition, you don't have to sweat yourself so much in the gym. You can enjoy your life. And also you don't have to eat so many times a day. You can just eat, a few times a day, once or twice a day. And so you have a lot of time free to do other things. So
True.
I think it's quite a good plan. Okay, so how was his, outcome after 3 months?
Yes, now we will see. This is like the appearance. So he was 110 kgs. The date is like 31st July. So this was his picture, and now his weight is 86 kgs on 25th October. So this was the drastic 24 kgs of fat loss. And also he lost inches. That is, his waist was 42 inch. Now it's 38. And he also
Wow.
told me that the shirt size is now from XSL XL. It has come to XL. So he's very, very happy now. This was his
Okay.
outcome, yeah, appearance.
Okay, so after 3 months, in 3 months, he lost actually 24 kilograms of fat.
Yes.
That is quite commendable, quite commendable. He must, like, he's lost like almost like a small child.
He didn't do any kind of cheating.
Okay.
Only 2 meals per day and 1 week of water fast. And that meals were obviously fats and proteins. That's it. This was his whole dietary regime.
Okay, now let's look at his, blood markers. So, yeah.
So yes, so this was like fasting sugar was 101. Now recent lab reports it's 70, so it has come down. Now he was insulin resistant, as I told that fasting insulin was 12, and HOMA IR, it is a test for insulin resistant. So it was 3.7. Now it's
Okay.
0.4.
3.7 is quite high, yeah?
Yes, it should be 2 or less than 2.
Okay.
Yeah. Then lipid also, it was 164. Now it came to be lipid means we in the lipid profile we need to see only triglycerides and HDL. Triglycerides should be lower and HDL should be higher. So it was 164. Now it's 64, and HDL is also at the rising level. It's 42 right now. It was 33, and now the
Okay.
ratio came out to be 1.5. It was 4.9 prior. Now it's 1.5.
And his uric acid
Uric
also.
acid, yeah. Yes. So
So,
even this cleared. Yeah.
yeah, please go
Yes.
ahead.
So this cleared that myth ki if we eat lot of proteins, it will raise the uric acid. So this also got cleared from this.
Right.
Protein
And
is
what
not.
about LDL? I think you wanted to, you've highlighted in red. So obviously you want to talk about a little bit about the LDL concept that everyone fears because it is raised, right?
Yeah, because see, this has a lot of scientific theory behind it. We should not fear LDL and total cholesterol. We should fear what is triglycerides, because that denotes tri, means 3 molecules of glucose attached to lipids. So that is the concerning factor we should read in the lab report rather than LDL. So LDL, it's though increasing, the person is my patient is absolutely fine, no issues of any kind of symptoms and nothing like that. So we should not fear LDL. It's just a carrying particle of cholesterol. So we need to see the triglycerides only.
Okay. Nice. So was he very surprised? What was his reaction after seeing his blood reports?
Yes, he was very surprised, first of all. And he told me that, of course, he had that concern of cholesterol. But then again, I did his counseling. I explained him not to fear cholesterol. Cholesterol is essential. Cholesterol, like, for example, 80% of brain is made up of cholesterol. I explained him everything. And then he was cleared on this. So he got his symptoms, like his energy levels were improved. He didn't had any lethargy or fatigue. Then
Okay.
yes, everything he told me that his digestion issue resolved. So he was very happy, and everything the query or the जो भी उसके मन में था regarding the cholesterol thing, it got cleared.
Okay, so I think he left a big test, review for you also.
Yeah.
But tell me one thing, because see, he was doing exercise and you asked him to cut his exercise to 4 days and that to just strength training and just limited him to do exercise. So what was his feeling after 3 months that, because it was just all food, or like, did he realize that?
Yes, he realized. He realized now that food plays a very important role, because it's not just you have to go and sweat yourself into gym 2 to 3 hours and then coming back from gym obviously you will be hungry. So it's of no point to eat a lot of carby food after the gym. तो वो 2 घंटे जो भी किया, it all goes in vain. So he realized that, and he now doesn't give much importance to exercise. Just goes for 1 hour. Also, he's
Yeah.
practicing some kind of breathing techniques and everything which comes into the lifestyle change. So he saw
So
this.
basically now he has time to explore other hobbies rather than just sweating it
Yeah.
out in the gym all day and
Yes.
not getting any benefit from it. Not that exercise is not good, but
Huh.
we can say that exercise also has to be done in a balanced manner with
Right.
adequate nutrition so that, you know, your body can avail of that benefit, right?
Right.
So tell me one thing, since, you know, what I find very fascinating is that, you know, you are a young person yourself on this low carb ketogenic journey and guiding young people, and your client was also very, very young, and you know, you have a community of young people you live with. Your husband is one, you know, he's also an IT software engineer.
Yeah.
So what is your advice to young people in India who are, you know, dealing with such, because of course there is a lot of awareness about exercise and eating right, but then there is also this rising level of junk food, etc., or eating sugary breakfasts. What is your advice to young people in India to, you know, maintain
Yeah.
their health?
Yes, I feel that first of all, you have to live at least junk. Okay. So like ordering the food from outside, going to restaurant, okay, these kind of things, if you stop, then you have achieved your like 50% at least. And then later start cooking yourself in your kitchen, in your home, because you are the only person who knows that what you are putting inside. Even there are a lot of places right now which you get keto and low carb, but still we don't know that what's going into their kitchen. So I feel that try cooking seek low. Everybody should learn cooking, and even male, female, whatever. And you have to cook for yourself, and that will be the stepping baby steps towards the lifestyle change.
Okay, and what would you say, because you know, your practice is based in, you know, Maharashtra and India, and you know, a lot of regional foods. Actually, we have religion, you know, festivals every 15 days, right? Every 15 days there are festival, and festival foods are different, or people fast for you know, religious purposes. So how do you see, you know, what are these challenges, cultural challenges, while implementing low carb in India, and what advice do you give to people to manage that?
Yeah, so I there are many patients right now who follow everything. Like for example, we have सोमवार का fast रहता है, या फिर Saturday fast, everything like that. But I explained them कि if you're fasting, then what does fasting mean? That give rest to your gut. So भाई उस दिन मत खाओ. Or if you still want to eat, then what are the options? Like for example, I explained them making items or foodstuffs from paneer. Okay, from paneer is allowed during fast, or from nuts, or nuts, something we can make out of coconut flour, almond laddus, like that. So also I give them recipes that if you want to do that fast and still want to eat something, then yes, you can do. You can follow all your religion pattern, everything, and it is feasible. The thing which you need is the willingness to change. That nahi, like for fasting I need the khichdi and everything. So if you are ready to make change, then you can absolutely do this.
Okay, thank you so much. This was very, very insightful. And I think Shashikant has already joined us. And I would also like to invite Mr. Anup Singh to join this conversation, because both of us are from D Life, both Dr. Mrudul and myself. And I think, you know, I would invite Shashi to, if he has any questions for Mrudul.
Well, I don't have any questions. I only have praises from Mrudul. So,
Thank
so
you
she
so
has
much.
come from the mainstream into nutrition, into using food as the medicine rather than medicine as a food. And what you've done is really, really commendable and really good. And we need more people like you. We need more doctors like you
True.
in every state, in every district, in every village, is what I say. I told this to Dr. Kishle also, that we require doctors. So if you kind of doctors, if we have in all the state, all the villages, then we will be able to battle the rising metabolic disorders that we see in India. And it's a very bold and courageous step which you have taken to leave behind something and gain something else. I think it's really commendable. And
Thank you.
and you sharing this PPT and your success stories, your case studies were really good, and very good value addition by Priyanka also. And I think you will do well. And I think you have the blessings of the entire team with you.
Yes,
And
yes.
I don't know if Anup is somewhere busy, engaged. So
Okay. But
it's okay.
I will just add myself that, I joined D-Life community just 3-4 months ago, and I've been following Mrudul's journey very closely. And through this, for this podcast, I got to know her more closely, and I realized how much, she has overcome. I mean, a PPT and sharing your story to public is certainly, important, but when you know her, you realize how much she's dealing with, and it's really commendable. I'm very impressed, and I think she's a trailblazer when it comes to young doctors, and who will take on India and combat this, the tag of diabetes capital of the world, right? India being diabetes capital of the world. So I see doctors like Mrudul really, taking that very seriously and combating this disease. Yes,
Anup,
okay, Mr. Anup has joined us. So
Yeah.
Anup,
So
yes.
congratulations, Mridula. Now, one thing I would like to specify is out of total 10 doctors enrolled for the course, you were the first from mainstream to successfully complete it. And now you are on a journey through your operations, change and evolve.
Yeah.
All the best for that. And we are always
Thank you.
around for any help that you need.
Thank you so much for having me here. Thank you.
Thank you,
thank
Mrudul.
you.
It was really a pleasure to talk to you, and thank you for explaining everything so beautifully. I'm sure a lot of people have learned, from your journey and, your expertise. Thank you.
Thank you very much. Thank you. Thank you, Priyanka. Thank you, Mrudul. Thank